my name is Carmen. I'm going to be your nurse today. I'm here to do a head-to-toe assessment on you, a physical assessment. Before I get started, I'm going to go ahead and do some hand hygiene here. And I am going to assess the room. I am making sure that I have all of my emergency equipment here. I have an SCD machine, I have a suction canister, I have the ambu bag, and I also want to look around and make sure that there's no fall risks here in the room, just scope out the environment and everything looks good. I'm going to raise the bed to a good working height for myself. And can you tell me your name?
My name is Julian.
Julian. And where are we, Julian?
In the hospital.
In the hospital. And do you know the date and the year?
Today's August 16, 2023.
Yes, 2023, August. Okay. And do you know why you're here?
Because I got my thing removed.
You got your appendix removed. Yeah, that's right. I'm sorry to hear that. All right, so I'm going to assess his behavior and his speech while I'm asking the questions. I know that he's awake and alert. He's alert and oriented ×4. And I'm also going to look at his facial symmetry. I'm going to have you smile, frown, raise your eyebrows, and puff your cheeks. Okay, very good. I'm going to take a look in your eyes, okay? I'm going to shine a bright light. I want you to just go ahead and look forward for me. His eyes are dilating and constricting. They're round and equal, and they're reactive to the light. Okay, I'm going to have you look at my pen here, right in the center, and look up and then back down at the pen. Up and back down at the pen. Very good. Okay, I'm going to be assessing your head and neck. I'm checking for any pressure ulcers. I don't see any pressure ulcers here. I'm going to have you look towards the wall. I'm assessing for JVD. Go ahead and look straight. And I'm assessing for the tracheal deviation. I'll go ahead and do my patient's vital signs. When I do the vital signs, I'm going to be looking inside of his mouth when I take temperature. I'm assessing his oral membranes. Okay, very good. Any confusion? No? Any sensory deficits? Ringing in the ears? No, none of that? Okay, very good. Now I'm going to be looking at your respiratory rate and pattern. It's all normal. The rate and the depth is good. Okay, any shortness of breath? No? Any coughing or sputum? Smoking? No, none of that? Okay, that's good, that's good. Okay, I'm gonna take a listen to your lungs, okay? I'm going to start with the left upper lung. This is the second intercostal space, mid-clavicular line. Right upper lung, second intercostal space, mid-clavicular line. The middle of the right lung, fourth intercostal space, mid-clavicular line. The middle of the fourth intercostal space, mid-clavicular line is the left middle lung. Left lower lung, anterior axillary line, halfway up the arm, and I'm going to have you move your arm a little bit. The right lower lung, anterior axillary space, halfway up the arm. I'm going to have you just turn to the side for me, and I'm going to hear the lungs of your back, okay? There you go. Okay. The right middle lung and posterior axillary line, halfway up the arm. And there's 4 on the bottom that I'm listening to. Anterior axillary line, halfway up the arm. Middle of the right lung, halfway up the arm. Sorry, middle side of scapula. Left middle lung, inner side of scapula. Right upper lung, top inner side of scapula, and the left upper lung, top inner side of scapula. And while he's back here, I'm assessing the coccyx area to make sure there's no pressure ulcers back here, and there's not, so go ahead and turn towards me. Okay, any heart palpitations? No? I'm gonna listen to your heart, okay? You don't have any dizziness? No? Okay. I'm gonna listen to the apex and the pulmonary. There you go. Herb's point, tricuspid, and the mitral valve. And this is where I'm going to listen to for 1 full minute. All right, everything looks good there. I'm going to be inspecting your abdomen to see if there's any distension, tenderness, anything like that, okay? I'm just going to look here. I don't see any tubes. And I want to take a listen, okay? I'm going to take a listen to your abdomen. I want to hear 5 to 7 bowel sounds. And I want to hear each quadrant for 15 seconds, starting with the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. Okay, and now I'm just going to feel the areas a little bit, okay? Okay, so tell me if it hurts, okay? I'm going to start with the right.
Ouch, that hurts.
That hurts? Okay, yeah, that's because you got your appendix removed, called an open appy. And so is there anything that makes the pain better?
Resting and meds.
Resting and meds? Okay, what about what makes it worse?
Coughing and moving.
Coughing and moving. Okay, well, I'll be sure to get you some pain medication soon, okay? Okay, I'm going to have you put your arm back down. Just palpating your abdomen here. When was your last bowel movement?
Today.
Today, okay. Any constipation? What about diarrhea? Are you passing gas? No? Okay. What about any blood in your stool? No? Okay. So then I'm going to perform a genitourinary assessment. I already know that my patient is continent. If my patient had a Foley catheter or any output, I would chart the characteristics of that with the milliliters, the characteristics including the color, any odor, any sedimentation, if it's clear, cloudy, etc. And then I would assess the genitalia if indicated. Are you having any frequent urination? Any burning when you urinate? Any blood in your urine? Okay, very good. We're almost done. You're doing such a great job. I'm going to be assessing your arms and your legs here, okay? All right. Any pain? Numbness? Tingling? Swelling? I don't see any swelling. His skin is pink, warm, dry, and intact. I'm going to feel both pulses. Okay, and I'm going to have you just squeeze my fingers here. Okay, very strong. Push me. Push me. There we go. Don't let me pull you. There we go. You're so strong. Wow. Any pain here? Numbness? Tingling? I don't see any swelling. There's no edema. I'm also going to look at his heels, and I don't see any pressure ulcers. And I don't see any pressure ulcers on his elbows either. Okay, I'm going to feel both pulses here and up at the top. And I'm going to have you pull your feet towards you. There you go. Now push down on my hands. There you go. Very strong. Okay, now push to the ceiling. Very good, very good. And also with your arm. Pull your arm towards you. Wow! Okay, very strong. All right. So I'm gonna lower the bed all the way to a nice height for him so he doesn't fall and everybody is safe. Are you having any difficulty here being in the hospital? No? Are you able to take care of yourself at work and at home? Yeah? Okay. Is there anything else that I can do for you while I'm here? No? Okay, well here is your call light. Should you need anything, please call me, okay? And I will see you later. And I will perform hand hygiene. So for this patient, since he had an open appy, he had his appendix removed, so he was having pain in the right side of his abdomen. And I would do my focused assessment on the abdominal assessment. I would be checking his wound, the dressing, change the dressing, administer pain meds, and then also just making sure that I'm looking at his abdomen